Hello, and welcome to the podcast supporting all of us through COVID-19. My name is Diane Zanier, and with me is Diane Binck. We're both members of the Psychology Department at the Greater Essex County District School Board.
Hello, everyone, and thanks for joining us.
We're here with another podcast to help families through this really challenging time that we're all experiencing as a result of COVID-19. Today, we're going to review some tips on helping children and teens cope with the current situation so that we can survive and maybe even thrive. This is directed towards helping children and teens cope and be more resilient. So, if you're a parent or a caregiver and you need some help for yourself, we hope that you'll first listen to the Care for Caregiver podcast. The articles we're using as references today are linked on our website, but we want to use this time to discuss and highlight some of the ideas that are presented.
It's important to note that this is an unpredictable situation, and it is understandable that most children and teens will be feeling out of sorts. As the Children's Mental Health Ontario article suggests, our old routines may no longer work, so we may need to find new routines to make the world a little more predictable.
Yes, Diana, that's so. But new routines need to be realistic and helpful, and the routines need to suit each family's individual needs. So, for example, families could research new recipes, cook one meal a day together, or maybe create a family sharing time where one family member can share what they've learned, explored, invented, or created in the day.
Those are all great ideas, Diane. I agree. It could also be helpful to include children and teens in creating the routine. For example, they could decide what time of day they want to set aside to do schoolwork, or there may be a time each day when children or teens can support other children within their social or family network with things like schoolwork or exploring resources available for kids online.
Another way to help kids cope is to help them find things to do or to think about. We need to focus on what we can do and not what we can't do, like play sports with our friends. It makes us feel unhappy when we think about the things we aren't allowed to do.
Absolutely. Focusing on what you can do is the key. It's okay to have some distractions so that we can give our brains a rest from worrying or academics. The CBC article, How to Help Kids, and website cbc.ca/kids have many ideas and suggestions for useful and fun ways to distract ourselves. The same resources will help parents find suggestions when kids complain about being bored, so we don't have to reinvent the wheel. It may be helpful for kids and parents to create a list of things they can do, a can-do list, so to speak.
Through all this, it is really important to maintain our connectedness with other people while still maintaining Health Canada's recommendations, such as social distancing. We may not be able to get together with our friends, but we can play with them online or by telephone. It's also important for kids to have regular contact with extended family or other important people in their social network.
Also, through all of this, is trying to remain positive and finding the silver lining. Despite all the unpleasantness and unhappiness, it's important to find examples of goodness. For instance, recognizing a good news story in the community. The Hinks-Delcrest article offers a source parents can consider for seeking out positive news events. Having a daily gratitude moment is another thing to do. Each family member could identify one thing from that day that they're grateful for. This might be ideal for dinner conversation or part of the bedtime routine.
You know, Diana, with working from home, I am truly grateful to connect with you today and for having been able to share these ideas with other people. We have to remember, none of us expected this. It's an unprecedented situation, but it won't always be like this.
You're absolutely right, Diane. It won't always be like this. In the meantime, please visit our website at publicboard.ca to read the full articles, so you can focus on taking care of yourself and your kids.
Absolutely, Diana. So to sum it up, it's a difficult time for all of us. We have to do the best we can. We have to be kind to ourselves and kind to our kids. Thank you for listening.